Hi, good afternoon, everybody. I'm Jody Hanson, Director of Public Affairs and Communication for Johnson County Government. With me today is Elizabeth Holshoe, who is our Director of Epidemiology. Happy to have you and happy to have Allison as our ASL interpreter. Thanks for those who are watching us on Facebook. And Elizabeth, I guess just maybe let us know how it went this week at our clinics.
It went really well. This was our first week of really ramping up the number of doses that we were administering earlier in the week, and our first week of having longer clinics. So we were running from about 9 a.m. until 7 p.m. Tuesday, Wednesday, Thursday, and then we also have a clinic tomorrow morning. So this is a really great evolution in our vaccine rollout, and that we're providing additional hours. And as we've moved into phases 3, 4, and 5, we know that we're now trying to vaccinate people who are working more. And so our typical vaccine hours, where we're running it from 8 to 1, were very difficult for some people to be able to access those appointments and get their vaccine. And so this week has gone really, really well. Like I said, about 3,000 doses a day for the past 3 days. Today was our second dose clinic for Pfizer. And then tomorrow we'll be running a clinic in the morning, and we're planning on administering about 900 doses. So a very busy week, and we're looking to do pretty much the same thing next week, where we have extended hours Tuesday, Wednesday, and Thursday for about 3,000 appointments each of those days. And at this point, all of those appointments are filled up, which is excellent. Friday of next week, we'll be doing second doses again. And then Saturday, we'll have another first dose clinic. And so as we move into needing to ensure that everybody has access to these appointments, at least through us, as well as our partners, this is a really great step in the right direction. So we're excited. We're glad that people have been taking the appointments. And we know that our partners in the community also have a number of appointments available. I believe KU, I think I saw had 8,000 appointments available as of yesterday. So they are also offering these to individuals in the community who aren't necessarily connected to their system. So if you are interested in getting a vaccine and have not been able to get one through us yet, definitely go to our website and look at the various links to the different hospital systems and pharmacies. Vaccines have really upticked in the number of doses we're getting here in Johnson County. And so, in the coming weeks, if you want an appointment, we should be able to get you an appointment either through us or one of our partners. So it's very exciting.
So I know it sounds like appointments are booked for next week. So looking at the week of April 19th, is there a certain day next week when people can expect things to open up again for that week?
Yeah, I think we're planning on opening up those appointments on Monday, and we're going to be doing it a little bit differently. So stay tuned on Monday. I guess we're not doing our Facebook Live on Monday, but stay tuned for Tuesday's Facebook Live, and we'll have some really exciting news. As we talked about yesterday, we've really gotten through all of the individuals who have signed up for our interest survey. So if you have yet to do that, go ahead and fill that out at jocogov.org/interest survey. And we'll make sure to invite you when we send out those on Monday and Tuesday. Otherwise, we'll be moving into an open appointment system. So that's very exciting. We know there are still people in our community who have not yet had an appointment and want one. So we will be doing that early next week and opening those appointments for the following week. I believe that we will have slightly fewer doses available through our own clinics because we are going to have a whole lot of second doses that we have to administer that week. But at that same time, we're also hoping to move into vaccinating our 16 to 18-year-olds through our school districts. So we've been working very closely, as you know, with our school districts for the past year, really, since COVID hit. And so we're in the works of trying to figure out how to provide some vaccines either during school hours through school nurses who will administer it at school, or through other clinics in cooperation with Children's Mercy. And again, Children's Mercy being an integral partner in this, no matter which way we're moving forward. And each district, I think, will look a little differently. Again, this is not mandatory. We're not going to force anybody to get the vaccine, even if they're students. This is just to provide an extra opportunity for us to get as many individuals in our community protected as possible.
So I know that sounds like you're still in the planning stages of that, but when it's implemented, will students and families hear from their schools or their school districts about opportunities?
Absolutely. So I believe a couple of our school districts will be trying to administer it during school hours. And so what that will look like is families will receive an opportunity to consent to that. They'll get some information online and they can basically sign it electronically saying, I'm okay with my student receiving the vaccine during school hours. Again, completely voluntary. Other school districts, it may look like an evening clinic associated with the school where Children's Mercy will come in. The other things that we're working on too are the potential for other public clinics with Children's Mercy for 16 to 18-year-olds. And I believe they have one actually at the end of next week. And I think those appointments may be full, but we'll continue to work with them to ensure that these students have the opportunity to get the vaccine. Although I know that a number of them already have had that opportunity, whether it's because they work in restaurants or grocery stores, JCPRD, if they work in an after school program, they've been eligible there. And as I was looking, we actually have had a number of individuals in those ages who have gotten vaccinated, which is very exciting.
Great. Well, we'll be watching for those, and hopefully parents will be watching for those opportunities for their students. So that's some good news. We have a couple questions that have come in. One of them is, how long will it take to see a decrease in COVID cases with the increase of vaccinations?
That's a really excellent question. We have seen our case rates, that incidence rate that we talk about, the number per 100,000, being really steady for probably the last month or so. Although today a slight uptick, but one day is not a thing to be concerned about yet. Unfortunately, there's some concerning signs from other parts of the country. We've seen in the Northeast that they've had an increase in cases, even at the same time they've been ramping up their vaccination efforts. And we're now seeing that happen in the upper Midwest, Michigan in particular, as well as some other states, Illinois, I think as well, where even though vaccines are ramping up, they are still seeing this concerning increase in cases and hospitalization. And a lot of that is due to the variants. You hear us talk about this a lot. In particular, the UK variant, what we call B117. And that just means that there's a mutation in the virus that allows it to be more infectious, about 50% more infectious. And so it really is kind of a race against time to try and get as many people vaccinated to protect them against both the virus that's been, from the virus that's been transmitted since last year, as well as this new variant that is being transmitted. And this week, we got our first notification of 2 individuals in Johnson County who both have been diagnosed with this variant, this B117 variant. One of them we've been able to interview and indicated they had never traveled, so likely contracted it here. So we know this virus is circulating. So it's really important that we continue to ramp up vaccination as quickly as possible to get as many members of our community protected, as well as continuing with wearing our masks and physically distancing, particularly if you are not immunized. And this will help us hold on until we can get a much larger proportion of our community vaccinated without seeing that increase in cases. But as much as I would love to say we're out of the woods, we're getting a lot of people vaccinated in our community. We are seeing these signs in other parts of the country that I don't think we're immune to here. So we're going to continue to keep a close eye on it, continue to ramp up vaccines as quickly as possible, and hope that we can sort of beat the clock on this variant transmission that we're seeing transmitted much more quicker in other parts of this country.
And it's probably a good idea to just keep reminding people to do things like wearing their masks, physical distancing, getting tested, all those things, though all those tools we've had in our toolbox, this whole year and more.
Absolutely. Testing is something that we talked about a whole lot earlier in the year and at the beginning of the pandemic, but it really is as important as ever. By identifying people who are infected, we can try and protect those around them by recommending quarantine, by having them stay home, by making sure that they know they've been exposed. And in particular, when it comes to this new variant, it is more infectious. So each person is going to infect probably 1 to 2 more people than they would have with a virus that was circulating for the last year in our community. So testing options are available. They're free at a lot of locations. You can come to our website, jocogov.org/coronavirus, or you can go to gogettested.com or Come Back KC, and all of those have resources for testing opportunities. Whether or not you think it's just allergies, particularly if you've never had allergies before, if it feels like a cold, but then certainly if you have some of the more concerning signs, a loss of taste or smell is one of the big ones that pretty much points to it being coronavirus. So please get tested, take advantage of those resources, and that will help us continue to protect our community from additional cases and protect our healthcare system. As we're hearing some concerning things out of hospital systems up in Michigan, where they're starting to have to cancel surgeries because the number of hospitalized coronavirus patients is ticking up at a concerning pace. And so they're concerned about their bed capacity there.
We have a question from Facebook. The two cases that you talked about in Johnson County who have the variant, the question is, were they vaccinated?
So we have been unable to interview the second patient. So I'm uncertain about their history. The first patient was not vaccinated.
Okay. And another question on kind of the same topic. If someone has the first shot and they're specifically asking about Pfizer, so if they've had a first dose of Pfizer, are they protected from the variants?
So we know that the first dose provides a fair amount of immunity or protection against contracting COVID-19, but it's really about 2 weeks after that second dose where you have that optimal level of immunity to protect you if you are exposed. Now, we do know that there are what we call breakthrough cases. So those are people who are vaccinated, who do still end up contracting COVID-19. And we have had a few of those in our community, but when you look at the fact that we have immunized over 100,000 residents, it's a very, very small percentage. And all of the research that's coming out now for Pfizer, Moderna, and J&J all show that they have really good protection against the variants, and at the very least, against severe hospitalization and death with those variants. There's another variant, the South African variant, B.1.35.1, that it looks like for symptoms, for having those symptoms of the disease, it's maybe not quite as protective, but still severe illness and hospitalization and death. The current vaccines do seem to protect very well against these new variants.
Okay, great. Thank you for answering those questions. We have another one we're going to switch topics a little bit now. We've got a question. When will businesses and restaurants in JOCO lessen their restrictions? So maybe we can remind people where we currently are at with restrictions.
Yeah, so it's a great question. As of right now, the restrictions, if you will, or the public health mitigation efforts that we have in place in Johnson County are really around masking and social distancing. So everybody needs to be masked in public areas, and that is unless you have a medical exemption, and still recommending that 6 feet of distance to protect everybody. The only other requirement that we have is for personal care services where you need to either make a reservation or check in online ahead of time. But as of now, there are no restrictions on capacity or on hours of businesses or restaurants.
And just a reminder that current local order lasts through the end of April. And so the Board of County Commissioners, sitting as a Board of Public Health, will decide what they want to do at that point, or they can make a decision, before that. But I would encourage people to watch these Facebook Live events, look at our website. There will be information on the news as well. So that's a great way to stay informed on where we are with that local health order.
Absolutely.
So another question, if we have had one shot so far and we contract the variant, will we end up being hospitalized?
Well, I'm as an epidemiologist, I never speak in absolute, but I would say that because that first vaccine dose, especially if you're at least 2 weeks out, provides a decent amount of immunity, about 80%, which means that you have antibodies in your system that can attack the virus. It just may not be enough antibodies to make it so you don't have any symptoms at all. So I would say that the likelihood would be very small for people to get hospitalized after receiving that first dose, particularly if you're at least 2 weeks out. Although anything is possible, and we know there are other variants that can circulate, but these vaccines are highly effective. And if we're really honest, they're more effective than a typical flu vaccine, where we think it's about 40 to 60% each year. So a much higher likelihood that you could still get sick with a flu vaccine. These vaccines, even after one, are about 80%. So definitely get that vaccine, continue to protect yourself. I think that's the most important part after you get that first vaccine. And, even after that second one, continue to wear your mask. Don't be around people who are sick. Try not to travel if you can, and just do what you can to keep yourself healthy and those around you.
So it sounds like we're not quite at the finish line. We might be getting closer, but we're not quite there yet.
Yeah, it feels like each week, though, we are closer. I feel like that light at the end of the tunnel is getting brighter each week when I look at the number of doses we've been able to administer and the number of doses that our hospital partners and our pharmacies have been able to administer. And we continue to see no outbreaks in our long-term care facilities, which is really great and encouraging. These were the places where We saw a lot of deaths. They accounted for about 2/3 of our deaths early on in the pandemic, and really through about January 1st. So the vaccines are great. They're very effective, very, very safe. But we're still not quite there to be able to sort of go back to full normal. But I think we're starting to approach it.
I think we are caught up on questions. I would just remind people next week, while appointments are full next week, a lot of our healthcare partners, pharmacies are still good opportunities to investigate. And then early next week, we will be talking about opportunities for the following week for new appointments opening up. So continue to watch our social media and our other platforms. Check out those other websites to see if healthcare systems have appointments. Elizabeth, anything else to add as we wrap up for today?
Nope, just my continued, we're gonna have some mixed weather this weekend, but Saturday should be lovely. If you're gonna get together with people, would definitely recommend doing it outside, keeping that distance, but the weather getting nicer is definitely gonna be a huge help for us in preventing COVID-19 because we know it transmits far more easily inside with windows closed. So if you're gonna meet with friends or family, definitely do it outside, enjoy the weather. Before long, I think we will be having enough people vaccinated. We can start, thinking about going back to doing life the way we used to.
I might catch one more question that just came in. I don't know if you can speak to this, but why is Michigan so high in numbers right now? Do you have any information on what's happening there?
Some of it's a combination of things, right? So we look at how many people were infected in the first couple of waves of COVID-19, as well as how quickly that variant takes hold. So if that variant of the B.1.1.7, the UK variant, got introduced into that community earlier than other places like Johnson County or, sort of more rural areas of the country, it's going to be able to replicate much quicker and make an effect much quicker, which is why, when we think about New York, where there's a lot of travelers and a lot of people, you saw it take off there first, and now you're seeing it in Michigan. And so it's probably a combination of pieces, including how many people were infected in that first round of waves, as well as that variant really having an opportunity to take hold and start replicating probably before and as the vaccination campaigns were ramping up.
Okay. Well, Elizabeth, thanks for sharing such great information today. We appreciate it. Thanks to Allison for being our ASL interpreter. And thanks for those watching on Facebook today engaged on this topic. And have a wonderful weekend. See you next week.